One of the things that makes family therapy different from other mental health professions and other psychotherapy is that we're interested in working with families in the contexts in which they find themselves. So most people seek mental health care with a 50-minute hour. They make an appointment, they go to therapy, whatever happens, happens, and they go home. But marriage and family therapists find themselves in the community, working with families as they encounter other challenges. The best example in the Aurora healthcare system is family therapists as they appear in the different ways in which healthcare is being offered. So we may have family therapists working in the NICU. We have family therapists who we're beginning a pilot project in cancer care where every newly diagnosed cancer patient would receive a family assessment. A family therapist, someone who's trained, would interview them and just look at their family structure, their family experience, and look for the vulnerabilities that might make it more difficult or even dangerous as they go through the stresses of cancer treatment. In the NICU, we work with these young couples who have birthed, sometimes very sick and vulnerable children. It puts incredible stress on a marriage. And we know that. And we know that the ultimate outcome is not a good one. So by intervening earlier in all of the stresses that can affect whole families, not just the person diagnosed or designated as patient, we can make a huge outcome, not only in the health of the designated patient, but also in the health and ultimate future outcome of the relationships within the family. So family therapy is done at hospitals, it's done in clinics. We're working more and more in the context of schools where we have children who are struggling, sometimes with their own mental health problems, but sometimes with their response, reaction, experience in stresses that are happening at home. And you need to engage the family in order to ultimately make those differences. And that is most respectfully done where families are going anyway, and doesn't necessarily involve a mental health diagnosis, but definitely involves a mental health intervention.